Thank you for joining me for the second part of this two-part series. Today I'm going to cover a novel diagnostic tool that you can use to screen your diabetic patients for liver disease, as well as reimbursement associated with this examination, and if it's financially feasible for your practice to do, or if you should refer them out to a specialist, like a hepatologist or gastroenterologist. The technology I'm going to introduce to you today to screen your diabetic patients for liver disease is nothing more than an ultrasound system. But there's something different about this particular ultrasound system I'll highlight in just a second. Before I do that, let's talk about, does this make sense for you to actually introduce and invest in for your particular practice, or should you refer those patients out? And it really goes on how many diabetic patients are you actually seeing in your practice. If you see more than 8 patients in a given month that have type 2 diabetes, this makes sense. The CPT codes, there are 2. There's one for the ultrasound imaging and another for the elastography. You would bill out appropriately for both codes. Those codes on a nationally stated Medicare rate runs about $200 in reimbursement per patient. So again, if you're trying to make a good business decision for your particular practice, evaluate it on, do I do 8 or more patients in a given month where I can screen for the liver? If you do less than that, I recommend from a business and finance standpoint, send them out to your liver specialist in the area. I have 2 different style of probes. As an endocrinologist especially, you're used to seeing this type of probe. This is what you would use on your thyroid or superficial structure. It has a high frequency, so anything close to the surface, like a thyroid, the image quality is absolutely amazing. You can apply color, Doppler to that as well. And this transducer here has a convex feature to it. It's called a virtual convex. And this is for your deep structures, such as the liver. There are 2 technologies. One is 2D shear wave elastography. Elastography takes a quantitative measurement of the stiffness of tissue, and it will stage it from F0 to F4. F0, they have no fibrosis. F4 is cirrhosis. And everything in between is a combination of either fibrosis, and as you get closer to F4, it turns into cirrhosis. The other aspect, the other technology, is called attenuation. Attenuation measures the speed of sound as it travels through tissues. That will determine if the liver has fattiness or steatosis, or if it's a healthy liver.